I like to be surrounded by people who have a common goal and want to work towards that goal. And so being a mobile surgeon, I found that that didn't change. It's just that when you walk into a foreign hospital, you have to build that rapport immediately and you have to build that bond. And then you and your new team have to work together towards accomplishing a common goal.
Hi, guys, and welcome to the House Call Vet Cafe podcast. I'm Dr. Eve Harrison. I'm a full-time integrative concierge house call veterinarian in Los Angeles, and I help other vets to build their unique mobile practices on their terms. This podcast is for and by house call and mobile veterinarians, so it is meant to give our community a platform to connect, to share our stories, to lift each other up, and to support each other. Most of us work solo as lone wolves, right? So for me, it's been really powerful to be able to physically hear the voices of my colleagues from all over the world and to get a chance to feel that we truly are part of a community of very real other human beings who get it. While you may be alone in that little bubble of your own vehicle when you're on the road seeing patients, I welcome you to join our community by tuning into our own podcast when you're on your way to your next house call. Whether you're a super experienced house call vet with 30 years of experience, you're a brand new prospective house call vet just looking to get started, or you're house call curious, there will be something for you in this podcast. Each episode, you will hear interviews from other mobile veterinarians just like yourself who are doing unique and innovative things, vets who are sharing their stories, their struggles and challenges, and you can also look forward to hearing valuable information and perspectives from specialists and experts outside of our micro niche. And finally, if becoming a house call veterinarian is something that you've been thinking about exploring, or you're looking for some extra support getting your own mobile practice to feel more profitable and sustainable for you, check out the information in the show notes about my course and our above and beyond supportive private community for members only, plus our monthly group coaching sessions within the House Call Vet Academy. You can also check out my free public Facebook group, which is also called the House Call Vet Cafe, the same name as this podcast, and which is a warm and cozy community for mobile vets to support each other in professional and personal development, in creative entrepreneurship, and in friendship. So thank you guys for spending time with me today. Let's dive into the episode.
If you're looking for help with ultrasound scanning, check out First Opinion Veterinary Ultrasound for independent machine reviews and online and in-person teaching options. FOVU, simplifying ultrasound.
All right. Hi, everyone. We have a really special guest with us today. This is Dr. Bill Scherr, who is one of my most important mentors in my whole career. He is a practicing board-certified small animal veterinary surgeon, boarded in 2009. And he is also, as of the last 3 years, the medical director at a growing multi-specialty hospital in San Diego. He is a husband to a beautiful wife, Karen, who we will hear from on the podcast as well, who has house call connections, and he is father to an extraordinary daughter, Georgia. These two women have been instrumental in teaching him empathy, compassion, and accountability, and have forever molded the way he leads and mentors. And I personally had the privilege of benefiting from that. So thank you for that. And thank you for being here. Welcome, Dr. Bill. How are you?
Oh, I'm outstanding. And if you call me doctor again, we're going to end this. So,
Welcome, Bill.
Thank you. Yeah, it's a privilege to be here.
Awesome. So first of all, I wanted to start out the episode with the question that I ask everyone. What's your favorite snack to eat in the car?
So are we talking like when we were going mobile and stuff like that, or just?
Yep.
Yeah. So I worked with a mobile surgeon before I got into vet school, and man, we used to go all over the place. And our goal in life was to find the perfect Slurpee.
All right.
We found it. We ended up finding. We thought that obviously a Slurpee is fantastic, no matter what flavor you get. But if you could find one that had caffeine as well, that would be the moneymaker right there. And some place in northern central California, we came across a place that had Mountain Dew Slurpees, and it was like hitting a hole in one on a golf course. It was awesome. So Slurpees would be the mobile snack.
That's awesome. I'm already about to go on a tangent right now from the next question I was going to ask you, because I remember when I was in my surgical residency, it was always a balance between caffeinating myself enough to be focused and alert and awake, and not caffeinating myself such that like my hands were like shaking and trembling and I was destroying everything. Do you have to negotiate a balance like that too?
100%.
Oh.
And the numbers keep going up as far as milligrams of caffeine that hit that threshold. But then, I just warn people ahead of time. I don't think that I'm shaking because I have a problem with my brain. I think it's just I didn't titrate right, and I'm a little bit over the point.
Got it. Yes, I'm very familiar with that phenomenon. So thank you for filling me in on your favorite snack. I'm trying to think of someone just told me about someone who was on the podcast. I'm completely blanking on it, which is embarrassing. But someone was telling me that they absolutely love Mountain Dew. It might have been Marcy McKeithen. So I'll have to let Dr. Marcy know about your Mountain Dew fiasco awesomeness.
This is
Oh,
Dr. Morse from the South because I feel like that was a Texas thing. Mountain Dew was so
is
big in the South.
it's from Detroit.
Okay, that
From
theory is now gone.
So, kind of filling you guys in, Bill, I almost called you Dr. Scherr, which was very bizarre. Bill was one of my mentors in surgical residency. And for anyone that's listened to my first episode where I described a few folks who didn't suck, Bill is one of them.
I'm glad to hear that.
Yes. And so I'm like really excited to have Bill on the show today. And, he's seen me through a very interesting time in my life. And so it's just really cool to connect now and kind of revisit the mobile phenomenon just from completely different lenses. Like I'm in a different place, Bill's in a different place, and we both have things to say about mobile practice. So I'm really excited for you guys to hear what he's got to say. So, can you tell me a little bit more about your experiences as a mobile surgeon and your wife, Karen, who we'll hear from, has done also some mobile vet tech work. So, we'll hear from her separately.
Yeah.
But yeah, I'd love to hear about your experience as a mobile surgeon because that's a little bit of a different kind of thing from house call vet, but it's still a mobile veterinary art. And there's a lot to be gleaned from your experiences as well. So, dump your brain for me.
All right, here comes the dump. So yeah, I kind of referenced before that before I got into vet school, I worked with a mobile surgeon. And so I was not quite a tech, I guess more of a veterinary assistant, but kind of a jack of all trades. I did everything required other than doing surgery, obviously. And I think that one of the things that stood out was that when he went into a hospital, his attitude poured in with him. And he was a great surgeon. He was a great friend. He readily admitted that he did surgery to support his windsurfing habit.
Nice.
And so if the wind was howling, he might be in a bad mood because he was having to do surgery. And sometimes the bad mood could come in the front door with him.
Oh, boy.
So I think that being able to see how people interacted with him and how he interacted with them and how that dynamic occurred just from being on the outside gave me a little bit of an appreciation before, even having the opportunity to do mobile surgery myself. When I came out of my residency, as you know, I worked at a hospital that we did perform mobile surgeries. And so one thing that I'll refer back to quite frequently, probably during this discussion, is the concept of team. Like I feel like building a team is so important. And it could be because I am probably a golden retriever at heart. I like to be surrounded by people who have a common goal and want to work towards that goal. And so being a mobile surgeon, I found that didn't change. It's just that when you walk into a foreign hospital, you have to build that rapport immediately and you have to build that bond. And then you and your new team have to work together towards accomplishing a common goal. And so it was a challenge, but it was kind of fun. Some people might know that surgeons can have a little bit of a reputation for being prickly, I guess.
Or
and so
prick. Prick.
I didn't know it was that kind of
Not
podcast.
you, not me, not none of us, but yeah, it's that kind of podcast.
Yeah, okay. All
You
right.
know who you're talking to, right?
Now I know my audience. All right.
Yes.
Very good. So I wanted to destroy that mindset. I wanted to walk in and be so different from that it would catch people off guard, almost in a pleasant way. Also, having seen what happens when you bring the wrong attitude into the hospital, my attitude I wanted it to always be that I was happy to be there. I appreciated them trusting me to come in and do the job and that we were going to work together to accomplish something great. So there were great aspects of doing mobile surgery. There were some challenges for sure, some unpredictables. Each hospital is a little bit different, but the common theme was always to try to build a rapport, build a team mentality, and do the best that we could for the patient.
Awesome. That's actually a concept that I haven't explored either on this podcast or any other platform that I have, that need to sort of quickly come in, quickly establish a rapport, because you're not working with a team that you work with every day. You're working with a brand new team. And if you're a mobile vet, you are working, or, if you're going into people's homes, that's your team.
That's
Sometimes,
exactly right.
right? Sometimes they're doing your restraining if you want to work that way. You don't have to. But I mean, it's always a team, you and the client. Like it's never just a unidirectional thing, right? So whether it's you're walking into a team of the family you're working with, a new tech, or you're walking into a clinic where you have literally a new team that need to sort of pivot and work on your feet and like put your best foot forward, because this is literally your first impression almost every time, right?
Yep.
Until you have a rapport actually with those people. And then it's, you don't, it's not the first impression, but you still aren't, necessarily as a mobile surgeon seeing these people every day. So you're kind of making a little bit of an impression each time, right?
Exactly. Yeah. And I think for the mobile vet going into a household, I've done orthopedic exams at people's houses.
Cool. I didn't know that.
Yeah, more as a kind of a favor, I guess.
Sure.
Obviously, I'm not doing surgery at people's houses,
Right.
but I've done a lot of drive-by patients, general exams, orthopedic exams, stuff like that. And I think you have a more invested team, when you walk in. And also, you need to take a significant amount of respect with you, respect for your new team. If you're walking into a hospital, you're walking into a person's house, that person already, every time I went into a hospital, I felt immediately like the general practice was showing me and my team genuine respect. And it damn sure better have been mirrored back.
Awesome.
Walking into somebody's house is exactly the same way. I think they're probably as or more invested in the pet's best outcome, obviously, because it's their pet. And what I teach my new doctors, my young doctors, is that your owner knows their pet every day, every hour. So if they say something's wrong, you should believe it's wrong and look into it. So, yeah, when you go into someone's house, I think is the same kind of thing. At least from my standpoint, it would be build that team, make sure that the team's working towards accomplishing the same goal, and then go get it.
Fantastic. Now, I guess the folks who are listening will probably by now have an understanding about why Bill and I get along. uh, that's in my first episode, I kind of talked about what it meant to me to be a surgeon and why I thought I might be a good surgeon, despite the fact that I'm generally not a prick or prickly. I mean, who knows? Someone might find me to be that way. We might be a prick to anyone. It's all relative, but my goal was always to sort of like not be that way, deliberately not be that way, and to like make it very clear that I had the utmost respect for anyone coming into my sphere and asking for my services, right? And then the other thing that you said that was really interesting, if someone says something, believe them. They know that animal a million times better than we do. We theoretically know the animal better than they do, but in real life, they know that animal. And I would say that's one of my top, you know, secret weapons. Like, so listen to Bill here. He's like top notch bedside manner extraordinaire. And so, like, if someone tells you something's going on with their pet, you at the very least, humor them because they need to be heard, right? That is like top 5 secret weapons of bedside manner and retaining the best clients and having them know that you care for them, that you respect them, and that you're listening, you know? So
Absolutely.
I'm really glad you said that, and it's not even about a mobile thing or not, but I think in the mobile context, it might carry a little bit more weight because people are expecting to be respected by you in their home or
Sure.
in their hospital when you're the guest, right?
Yep. Exactly. Yeah. Being in a hospital where I'm not mobile currently, having people come in, especially with a lot of orthopedic stuff, I mean, probably recall very clearly, you could have a dog who is not putting any weight down through their back leg for 2 weeks straight. And then they come into the hospital and they look like a show dog. Perfect.
Yes.
And the owner's like, this, just like taking your car to the mechanic. It never makes the noise.
Yeah.
I get that. And if
Yeah.
we don't find something, I tell people, look, here's my personal email. Go home, take some videos of what you're seeing because I know that their adrenaline level is way up here. And they come into the hospital, there's smells, there's sounds, there's sights, and there's some unknown dude who is now hovering above them, dominating. Go home and show me what you're seeing because then maybe we can start to work on it. So yes, I definitely listen to my owners. They know what they're talking about.
Yeah, for sure. And I was thinking that about that very thing. I was going to ask you about it, but you brought it up that when animals are in the clinic, they are, their adrenaline is masking any lameness. So particularly with lameness or orthopedic issues, a house call visit is a really special thing because they're not masking the clinical signs that their owners or their caregivers are trying to show you. I mean, I don't know if you've done enough like actual house calls to have seen a difference there, but I'm going to ask you anyway. Have you seen a difference?
I think in severity.
Okay.
Again, when somebody new comes in, there's excitement, there's guarding maybe. Dogs are fantastic. There's so much that we could learn from living life if we just pay attention to our dogs a little bit more. But something like an arthritic knee is not going to keep a dog from doing their job, which is obviously to keep me out of the house.
Right.
Or at least to keep an eye on me. And so while the severity of the lameness may be significantly different than what they would do under normal, less stressful situations, I think that the level of excitation and stimulation is less when they're at home and has given me traditionally a little bit better appreciation for what the owners are talking about.
Awesome. I've found that to be true as well. I guess for me, the big difference between doing the exam in the clinic and doing the exam at home is the animals are just like a million times more relaxed. Like they're not tense. Like in the clinic, they're tense. Like you can't palpate anyone's abdomen. Like you can't bend their knee or their leg because they're like holding it. At home, they're just like completely relaxed. I can palpate any abdomen. I can palpate any cruciate. And it's shocking to me, having spent 3 to 5 years predominantly in the clinic and then slowly titrating the house call visits and just seeing the difference in what you can tell from the physical exam and just the state of mind of the animal. It's absolutely uncanny. It's insane.
Yeah. And for you, I think what you just said was really important as well, the state of mind, because you can see it in their eyes. You can see it in their face. I mean, I've got 2 golden retrievers. So they go into the hospital, it's a car ride, and then there's somebody paying attention to them. And even if it's an orthopedic exam, they're still getting touched. So whoa, it's a great day. But most of my patients aren't really that way. And you can see a level of trepidation at the very least. So yeah, I think being at home is orders of magnitude more reflective, I guess, of what they are probably doing.
Yeah, I mean, it also makes me think there's like literally no blood pressure in the hospital that could ever be accurate, ever. Like just seeing really like these animals, we think that they're like high strung, but no, they're normal and they're like super chill at home. I can't like I'm veering off on another subject here, but I want to tell you about a time that I'd been doing house calls for a few years and I got kind of soft and I forgot how scared animals are in the clinic. I did a relief shift and I accidentally cornered a Rhodesian Ridgeback. And the dog didn't give me signs that he was like going to bite. He was scared, but the bastard came out of the corner, bit me right in the crotch. And I was like, I had to leave because I was like crying. And I was like, I haven't been bitten ever in my life. I just like my guard was so far down and like
Yeah.
just like having worked with these animals that are just so relaxed in the home. It took me completely by surprise.
And maybe his hackles were up, but you just couldn't tell because he's
Yeah.
rich.
Yeah, he's a Ridgeback. It's hard to tell.
Yeah. Yeah, it is. It's,
Yeah, I guess with the Ridgeback, their hackles are always up, aren't they?
they're always up. They're
Got
always up.
it.
Yeah. Okay. All right. You're caught up. All right. Yeah, it is a lot different, but, keeping in mind the number of patients that I go over and take a look at, either at the owner's house or sometimes they'll come by my house and we'll do it out in the front
Mhm.
yard. We'll do it at the park, we'll do it places where, it's not quite the stress of getting in the car, going to a place that smells like 10,000 other animals, where you can hear other animals barking and yowling and doing all the things that dogs do and cats do when they're in the hospital. So yeah, it's actually, and if I could say it, it's more fun too. It's more
Oh, it's
fun.
way more
Yeah.
fun.
So yeah, maybe I'm starting to think about doing maybe mobile house orthopedic exams.
Yes. I'm gonna pull you over to the dark side. So kind of shifting gears a little bit, can you tell me about the fact that you're now a medical director of a hospital, which is super cool. I'm not surprised at all. Like to me, your strengths have always been leadership, bedside manner, teaching, mentorship, and things like that. So now you're actually running an internship program in San Diego. And, we've had a lot of conversations about leadership and, even when you were kind of mentoring me as a young potential surgeon at the time, about the leadership that you need to have in that position, almost a decade ago now, I'm realizing, I'd just love to hear a little bit more about your experiences now in that role and, what leadership means to you. Kind of open ended question for you there.
Wow. Yeah. So
Echo.
chapter one,
Mhm.
leadership by Bill. Yeah, I guess I don't even know where to start with all that. I have found that it's a lot different as medical director. So I guess start way back at the beginning when I was younger, I tried to be successful because this may be going too far. I have a tremendous fear of failure.
Okay.
The idea of failing the people who are depending on me is so untastely. I cannot handle it. And I found that actually it's like the force in Star Wars. I think it can work for your benefit or it can work against you. And so I found that there were times when I was not taking opportunities to do things because I didn't want to fail. To fail at something that I really wanted to do would mean that I wasn't, cut out for it. And I'd much rather give it a half-assed version of it and just say, well, I didn't really try. That was when I was young.
Well, I just want to say it. I mean, that's a very common thing for veterinarians in general. So you're speaking on behalf of everyone, myself included. I get that.
Yeah. Well, I'm glad to hear that. Once I got into vet school and I was raising my hand for years, just asking for the chance, just one chance to do the thing that I knew I was meant to do. I mean, I was kind of past the fear of failure thing. At that point, I was just flat motivated. And from that point on, I kind of had an individual leadership type that was kind of just lead from the front, lead by example, work harder, longer, better than anyone around you. And if somebody sees that and they want to join in, that's awesome. We'll do it together. And that'll be more fun because now it can be competitive, and a little bit of healthy competitiveness goes a long way. And so setting the bar high and hitting it consistently was what seemed to work. And I didn't expect most people to keep up with that kind of consistent high level. But if they did, well, we need to reset the bar and we'll just see how high we can take this. So it was great. It was healthy, but it was me doing the best that I could in every facet every day. And then if somebody saw that and they said, hey, it's not impossible to do X, Y, or Z. He did it. So we can do it. And if we all do it, then we are achieving great things. As a medical director, you're not really thinking about yourself as much. You're thinking about the team. And I've always prioritized team, but as the medical director, it's different. I'll flat say it, it's hard. It's harder. And so early on, it kind of hit me in the face. It's like, well, yeah, I could keep doing the things that have been successful for me, but how do I go to somebody and help them be better at what they do when they're already high achievers, when they're already exceptional? How do you help somebody become a better version of their exceptional when what they've been doing has obviously worked for them up to that point? And so being a coach, I think, is harder than just being an example, if that makes sense.
Yeah. Yeah.
And so I find now that I have, and this my definition of it may be wrong or it might be different, but kind of a servant leadership mentality, which is
Yeah.
where my question now is, how can I help you achieve the things that you want to achieve? How can I help you be better? What can I do for you to help you get to wherever you're going? And in doing that, then I don't really expect everybody to do their job the way I do it. I don't expect everyone to go into a room and talk to owners the way that I talk to them. I don't expect them to do the things the way that I do them because it's not going to work for everybody. If some people tried to do things the way I do them, it would just be fake.
Right.
It would be counterproductive.
Right.
But if there's a way that I can support somebody in doing it the way they do it, just so that it is received best, then I think I'm doing my job. And so as a medical director, I feel like that's kind of where I come from. Yet what I found is leadership is flexibility, not only in the way you lead, because obviously my leadership styles have changed as I've grown and gotten older, but then also each person. And by default, I think if you're going to be talking about leadership, if you're going to be a leader, you have to have a team. That makes sense, right? If you're going to
Right.
lead, you got to have somebody that's there with you. So
Yeah.
each one of the individuals on your team is going to be different. Their needs are going to be different. Their needs are also going to be changing as they grow and develop. So flexibility of mindset, I think.
Very cool. Yeah. So it sounds like you kind of made a shift from leading by modeling, leading by example, and leading by doing your very best and hoping that everyone would be inspired and come along, which is a good leadership style. But now it's a lot more engaged, interactive, and much more focused on tailoring and customizing to the other individuals. It's not just like follow me or else, you know? And that's
Yeah.
such a, like, non-surgeon thing, and I love hearing you say it because I mean, it's great, it's just great, it's like, it doesn't have to be my way or the highway, right? And that's such a classic surgeon mentality, and I
Yeah.
think to be able to soften that and that flexibility of just, like, "This is what you need, this is your neurodiversity, this is your neurodivergence, and how we're gonna work with your brain, like, your brain has succeeded up until now with what you're doing, so clearly there's something there and I need to work with what you're giving me and, how your brain works and the kind of doctor you want to be. How do I bring that out of you? So I love that you're seeing your mentees, like you see them as a person and as an individual and you create the space for them to do that. You were doing that before, but I'm sure now it's much more of a, and as of my experience as your mentee, but it sounds like it's much more intentional now and you kind of like owned that as a technique to let your mentees grow how they need to grow.
Certainly try to. Yeah. And I mean, when I was lucky enough to be your mentor, uh, I didn't really have much power to wield. So couldn't really give you a whole lot of flexibility or, guidance or whatever. But yeah, now I have a little bit more. Although I'm still the last one to know anything. And I will say that although I do try to find a way to assist people to be their best version, I am still trying to put myself out in front and, be there early, stay there late, do whatever I have to do to be. If I tell somebody that they need to do something better and I am not doing it better myself, that's not gonna fly with me. It's certainly
Right.
not gonna fly with them, but it's not gonna fly with me, which is equally important. So yeah, I'm still hard headed in that regard.
Well, you can still be the change you want to see while also giving the flexibility. Like, of course, those things pair together perfectly. So I love that. Can you talk to me a little bit more about what you might mean by servant leadership?
Well, you kind of touched on
Mhm.
one of the ideas of a common theme in leadership, or at least what a lot of us think of as leaders, that dictator type hierarchy where you say, no, you be here, you do that, do it or else, that kind of mentality. And, when I was in high school football, that worked. they, they told us to do stuff. We did it until we threw up. And then, we didn't get in trouble anymore. But when you're surrounded by people that you genuinely respect and you want to see them succeed. Yeah, I have a vision for my hospital, and we can go down that tangent if you want, but I have a vision for North County. I want to see it as the premier hospital. I want it to be the place on the West Coast that people want to work. They want to take their pets. I want referral veterinarians to want to send patients to us because they know they're going to get the best experience, I guess, all the
Yeah.
way around.
Yeah.
And while I guess you could tell people how they have to do their job and what the expectations are and bring the stick more often than the carrot, I also think that you got a lot of people who have been really successful. I mean, if you think about it, when we were in high school, it was kind of representative of the general populace. And then you go from high school to college, and now you're in more of an elite group. You go from college to vet school. Come on. So as you continue moving up, you're surrounded by people who are not slackers. They're not trying to look for an easy way out. They're not looking for an easy day. If you can support them and help them find the best method to be ultra successful, then everybody wins. And so when I say servant leader, I mean, like my job is to carry more burden, maybe sacrifice more so that I don't want to say subordinates, but my colleagues can suffer less so
Yeah.
that they can focus on the things that will allow them to do a great job and be happy where they are. I mean, God, what we do is hard, right?
Sure is.
It's hard. And the last 3 years have not made it easier.
Oh.
Mm.
Uh-huh.
But if you're going to do this job and you're going to do it for a long time, you should probably be enjoying it. And so if there's a way to try to help people find that balance. And I mean, I joke about a life work balance.
Yeah.
I've heard it mentioned, but I think in my world, I believe the scale is something like this.
Yeah. Yeah.
But that's a balancing point. It's just not equal. So, we spend a lot of time at the hospital. We spend a lot of time with our patients. We spend a lot of time with each other. We don't spend as much time with our families as we should. I mean, all that is real.
Yes.
So if you're going to be a servant leader, then you figure out a way to make that environment as family-like as possible. You sacrifice so they don't have to. They eat
Yeah.
first, you eat last. I mean, that's the way it is.
Fantastic. I love that. And you've mentioned to me before in conversations we've had kind of some influence from like the Navy SEALs, like it's high performing, ultra high performing environment where there's leadership that has to happen in a certain way and motivation and inspiration and strength and servant leadership and, where everyone takes care of each other. And can you talk to me a little bit about that? Because some of the things you've said in the past have been very moving to me and have been a really clear example of some of the ways that I guess you're inspired to lead.
So talk about how the special operations community and the military in general have shaped the way I have decided to perform.
Yeah, and I know you have one of your best friends, I think, has been in that environment, so you've had a little bit more exposure to
Yeah.
that. So yeah, I'd love to hear a little bit about that.
Yeah. So I think I was introduced to the military community and books written by high performing warriors at a time when I actually needed to.
Okay.
This would be pivotal time in college when if I didn't really like doing something or if I didn't really want to do something, then I found an excuse to put it off. If I was afraid that putting my everything into something and having it fail in my face would indicate that I was not quite as impressive as I thought I was. So I read a book by a guy named Richard Marcinko, and he wrote a book called Rogue Warrior. And he was a former Navy SEAL. And I mean, there's a lot out there, but he kind of had some ideas that just hit home and they were simply stated. And it's kind of what I needed to hear at the time when I needed to hear them. And one of the biggest things was you don't have to like it. You just have to do it. And like how simple, I think about some things that I've heard and like, there are no unique ideas. I've heard this and I think to some degree, it's probably pretty accurate, but sometimes an idea that is there, it gets stated by the right person in the right way and it just you in the face and it sticks. So you don't have to like it. You just have to do it. the only easy day was yesterday. I mean, these guys, they live a life that is, I guess, not as regarded as it should be. They're not seen by the people, I think, and held in as high regard as they deserve.
The Navy
And that's all military. I think what the sacrifices that they make and that we have no idea about is just, I wish there was more we could do for them.
Yeah.
But when it comes to stuff like leadership concepts, they know how to get the job done. And if you think about it in terms of, yeah, sure. I mean, there's a pile of poop on the floor. I mean, I come across this kind of stuff all the time. Another team of Navy SEALs wrote a book called Extreme Owner. It was just like the name implies. If you, or at least what I took away from it is, if I decide to own the consequences of everything in my sphere, and that's not to say that I have to do everything in the hospital. Quite the contrary. I have a team that is fantastic that I work closely with. I trust them to do their jobs outstanding. Ultimately, if I see it, I'm not going to unsee it. And if I decide there's a pile of poop over in the floor, unless you're owning everything in your sphere, there can be confusing. There can be frustration. There can be angst. Who's supposed to clean up the poop? Where did the poop come from? Somebody looking to test the poop. I mean, the fact of the matter is, if you own stuff, then you say there's poop on the floor, you go clean up the poop. I'm not below that. I'm not above that. There's poop. If you pick up the poop, you don't have to like it. Just do it. The same thing comes, and you probably remember this. It's 1:00 in the morning. It's your 80-hour work week, but you're the one who gets called to come in and save the dog that's bleeding to death. Nobody's happy about getting that call. It doesn't feel comfortable. It's like a sledgehammer hitting you in the head.
Sometimes.
Remember?
I do.
A sledgehammer does not get any softer as you get older either. I promise. It is terrible. But it's yours. You own that. And so it's time to get up, put on the scrubs, and go do what you do. And the other one, the only easy day was yesterday. I mean, that's brilliant in its simplicity. If
Yeah.
you just expect that every day is going to be a new adventure, and the day that you took it easy was actually yesterday, well, great, you're prepared. And I think that kind of feeds into the Stoic thing too.
Mhm.
I,
Yeah. Talk to me
I,
about what Stoicism means to you. We've talked about that a little bit as well in the
yeah,
past.
I am. Again, for me, it is, I don't want for much. I don't want a whole lot of stuff. I want my family to be happy. I want my family to have everything that they want. But as far as wanting stuff, like I really wanted to be a vet. I wanted to be a veterinary surgeon. I wanted that. But beyond that, I don't want for much. I've been very blessed and gracious. The return on investment has been amazing. My life is, I couldn't ask for more. So I think for a Stoic, if you don't want for much, but you get something, then you appreciate it. You appreciate it, you're grateful. And I am very grateful for what we have. It also, to me, means that I understand that I don't really have as much control over a lot of things as I once thought I had.
Yeah.
And I have absolute control, though, over how I react to those things.
Yeah.
So the only thing that I can really control is my response to an event. And so I think that brings some peace of mind. If there's something that's going on and I can't do anything about it and it's out of my control and I can't help anybody figure it out, then I got to let it go and move on to the next problem. But if there is any way that I can help, then I take extreme ownership and I do my part and I go help. I go clean up the poop. So the two of them, I think that Stoicism is not suffering. Quite the opposite, I think. It is finding peace and not sweating small stuff. Just being mindful of your response to things and I don't know, not getting too worked up about things.
That's awesome. And I did prepare a tiny little bit. I knew we were going to talk a touch about Stoicism, and I thought I might elaborate a tiny little bit. just to kind of get folks on the same page if they're not a moral philosophy nerd like you and I might be. So I have a few definitions and a few like synonyms that are out there for stoicism.
Okay.
I think it's really interesting to sort of like clarify that and just kind of bring it back home to how that applies to being a veterinarian and a leader. Because I think it's just really interesting how you brought up stoicism in terms of leadership and servant leadership and just that of headspace to be able to accept, that expression like, God give me the strength to accept the things I can't, the wisdom to know the difference, something like that, right?
Something like that.
That's
Yeah.
that's stoicism. But I just wanted to so Wikipedia says stoicism is two things. One, the endurance of pain or hardship without the display of feelings and without complaint. That's like your stoic dog. That's not what we mean here, right?
It goes something like, maximizing positive emotion and minimizing negative emotion when you understand that you don't have as much control over stuff in your life as you think. By controlling your response, you kind of float in that
Yeah.
mid zone of not being too high or too low and not being negatively impacted. It's not to say you're apathetic or you lack
Right.
empathy at all. Quite the opposite. I think, you can take joy in the simple things, but yeah, for me, it is, not the stoic dog thing. You don't need to suffer, but it's also realizing that, it's not fair or unfair. It's not just or unjust. It's just the way it's happening. And so if you can make it better, great, make it better. If you can't make it better, move on.
Right. And there's some degree of acceptance there, I think, is kind of at the heart of it. But I think
Yeah.
we've kind of like covered the sense of it. And there's also a little bit of like determinism versus fatalism. So determinism meaning that we can determine everything that happens to us. We have control over our whole lives. Everything we do is because we made it so. Fatalism, on the other hand, is there's fate. Doesn't matter what we do, things are going to happen no matter what. And I think that stoicism has almost like a blend of them a little bit, that for the things that we can control, we control them. For the things that we don't have control over, we don't have control over them. So it's just acknowledging that there's these two possible ways to see our ability to create change or to lead a group. And
Right.
when you're leading a group, there's a lot that's not in your control, right? Like every individual has their own agenda, right?
Yep, absolutely. And, I think it's important to make sure that those individuals, as long as they're focused on achieving the same goal, they don't have to do it the same way.
Love that. Can you tell me a little bit about how you might think of applying leadership in a mobile vet context? So most of us listen to this podcast are solo vets coming into the home. We
Yep.
might have a vet tech that works with us. We might have, a virtual assistant. We might have a small team, but I'd be curious to hear how you might suggest or inspire others to apply some of these principles to a very tiny team.
Well, if you're talking about going into a person's house, or are you talking about doing mobile surgery?
Either. I'd love to
Oh,
hear your thoughts on either.
okay. The mobile surgery theme, having some experience with that, I'll say again, I can't stress it enough. Being a team, super important for me. And so going in and letting your new teammates know that you're there to support them, they're there to support you. We're going to work together and we're going to give this patient a chance. Being respectful in doing that, ultra important. I also found that clarity
Yeah.
was very important. So when we would work with our team at the brick and mortar hospital, we would work hours and hours, days, and years with each other to the point where a lot of times we didn't even have to use the right terms for things.
hmm
You could almost point in the direction, or even sometimes, your tech team would know what you needed before you did.
You grunt and they like bring you the thing.
That's the thing. Yeah, exactly. And yeah, I mean, everybody's got a mask on and the suction's on, so they can't hear anything anyway. But if you do that in a mobile setting and the tech looks back at you with a blank stare, that's on you. Or if they bring you the wrong thing, that's on you. That's the surgeon's fault. So being extremely clear on what you're actually asking for in a respectful manner, that's huge. I think that that's super important. And I think it probably translates to going into a house call as well, except that you wouldn't expect maybe your layperson to understand what in the world Balfour was, or a reflex hammer maybe would be a better
Right.
analogy. Let's see. Oh, other thing that I always try to do, and again, it kind of goes back to my previous history, seeing my mentor at that time, my surgeon, bringing an attitude that was infectious, whether it was good or bad. So knowing that, I would always try to bring a calm, reassuring, and even a fun attitude.
Mhm.
We would try to joke around and have a good time until it was time to get very serious. And then when we got serious, you got serious. But again, what we do is so hard no matter what that if you can take the moments and take the opportunities to just enjoy what you're doing in the moment, I think everybody benefits. So those are the big things that I think I would probably try to expand on as a surgeon going into a surgery in a mobile setting. Going into a house, it's the same kind of idea. Your owner is your teammate. Their house is their house.
Yes.
You're a guest. You're a guest who has been invited to help them with a family member, which is a privilege, or it should be.
Mhm.
You should be honored that they contacted you to look after their most prized family member. And so if you take that kind of a mentality in, then you're already starting off in a good place, I think. And I think that you and I had spoken about it too. When I go in and do a consult, I don't have 15-minute consults.
Right.
And I don't think you do either. And I think
Oh.
we're not getting paid by the hour.
Right.
And so it could be argued that 15-minute consult would be in my best interest, see more patients, see more owners, do the thing. But what I do is complex. And in order for me to give owners just a glimpse at the decision making, making sure that they're making an informed decision, I get to spend time doing that. And I mean, that was one of the things that I didn't necessarily enjoy about mobile surgery. I love going in and talking with clients.
Mm,
Um, I
yeah.
love educating the clients. I love seeing their eyes light up when they finally understand what's going on. I love when we are able to do the physical exam and they see that it's not something traumatic.
Right.
Right? When you test cranial tibial thrust and you can diagnose an ACL tear and their dog doesn't make a peep, and they say, "Oh," and you can show them the tibia moving forward and backwards, and they say, "Oh, it makes sense now."
Yeah.
I mean, that's huge. So going into a person's house and being able to do that is magnificent. So client communication is, I think it's key. As a mobile surgeon, my client technically was the referral veterinarian.
Right.
And
Right.
man, if I was lucky, I got maybe 5 minutes of their time. They're just hopping
Yeah.
all the time, going, 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 going. I don't know how they do it. I mean, I got so much respect for them. I do not know how they keep it up. And so, I tried to talk to the owners a little bit here and there, but it just wasn't the same. And I had a hard time with that, I think.
Yeah. Yeah.
And I think that you said that you like to go into an owner's house and spend as much time as they need to feel comfortable with the knowledge that you're giving them, which is outstanding.
Thank you. Yeah, I like to do long form, how it's called, and podcasts apparently. I can't agree more with some of the, kind of applications that you just mentioned, like the clarity. Absolutely. I mean, I found that, not always, but I found that if there was some sort of breakdown between me and my team on a house call basis, it's because I wasn't clear. I look back at my notes and I usually type, I'm a written word kind of girl. I give everyone directions via written notes. And I look back and I'm like, dear God, how could anyone have possibly figured out what I was trying to ask? Like, no wonder they fucked it up. I wasn't clear at all. And I think, yeah, that's like always something that I'm working on, like clarity of the word, like my written word, my getting the idea crystallized, and how do you do the task? How do I want it done? Why do I want it done? Sometimes that helps too in terms of clarity. And then the other thing you said, sense of humor and having things be fun. My God, like there is something really magical about that. And I think when I go into someone's home, we're joking around. There's a lot of joking around. There's cursing. There's, we're being ourselves. We're making fun of the animal if it's appropriate, lovingly, of course. But that there's something I think that's where the longevity and the sustainability is in veterinary medicine. Part of that has got to be, unless you're doing euthanasia only, in which case we're not joking around. But for folks that where there are places to laugh, finding those times and letting that be. It doesn't always have to be so serious. You can be a board certified surgeon and you can laugh and make jokes, and you can be a house call vet that is like sincerely and authentically connecting with that client and make jokes and laugh and have a good time. And I think that's really important. I'm glad you mentioned that.
I think it's super important and probably, dare I say, more important as you go into an owner's house, not only for the owner, but I think that they appreciate that. You could go in and just be cold, to the point, all business. And that will also work as long as you're doing your business right. But what we do is a luxury job, right? And people don't have to get their dogs and cats fixed.
Right.
What we do is a luxury. So to some degree, when we go and we are servant leaders or we are serving our owners, and to some degree, it is about comforting them. And I think that enjoying the moment and laughing, or at least, making the effort, I think that's natural. That's human nature. And I think it would be highly appreciated. The other thing is, if the owner is relaxed and having fun, is not the patient going to be more relaxed? So I think it's beneficial on all fronts.
Totally agree. I think there's so much, and I'm kind of veering off subject here, but I like the topic so much. And I just like to discuss this. I think that sort of white coat syndrome, it's a thing that animals experience, but I think it's a thing that happens to us too, where we become like institutionalized, like not like being committed to an institution, but like we become like afraid of the board, or we become like, what is the gold standard? And I must do that. And that's what are my colleagues going to say about me? Can I write that I did this and this in the record? And that somehow takes over priority over our connection with our clients. And I think the thing that helped shake me of that, I had a little of that. I think most of us kind of hatch from the vet school egg with that fear and that sort of like almost misguided approach to like, this is about me. It's my ego. I have to do it right. I have to follow the rules. And it's like, no, we're here to help the animal, period. We're here to be there for the client, establish a real connection with them, and comfort them and help them,
Yep.
period.
Yep. I agree. And, not to say that we should be all people's psychologists. That would be brass and probably not really appropriate. So I can talk about some things, but probably psychology for the owner would not be great. But if it seems like too much of a burden for an individual to be personable with an owner, because I think we get into veterinary medicine. Sure, we love animals, but I think just as importantly, I have found that I love people who love animals. Like, these are my people. And so if you feel like it's too much of a burden to interact with the people that have the animals, maybe veterinary medicine's not right. Maybe it's not the right fit. Ain't no dog ever paid me $7,000 to do a TPLO.
It's the
Well,
people,
owners,
right?
yeah, the people love their animals, and that's why we gel with them, or we should. I think that if you're talking about building a team with an owner right from the beginning, what is the one common ground that you have to work from right from the beginning? You both love animals.
Right, right.
Yeah.
Yeah, that's an interesting perspective too. I slightly disagree with that, and that's okay. It's not that I disagree. I think that have like an amendment to add to that. That I think that a lot of people kind of find themselves burnt out by the people because either they're overworked by the system, they've been trained in a way that doesn't encourage that sort of interpersonal connection, or they have this fear-based thing going on behind them, or they don't have the control or the power to work with the right clients. Some people are abusive. And I think if you don't have the agency to control who you're working with, and you have to be nice and smiley and happy to any old asshole, that's going to get old real soon. And so I personally wouldn't say that, someone who's burnt out or compassion fatigued by the humans is maybe not in the right field. I think they need a change. They need to do something different. Something's got to change if
Yep.
the clients themselves are burning you out. I don't know that it's that they're not inherently meant to be a vet, but I do very much agree with you that something has got to change.
Yeah. Yeah. It's, and that, I mean, I imagine we'll get to it at some point. I was lucky enough in my internship, of all places, there were a lot of places, a lot of aspects of my internship that were lacking. But one thing that I took away from it was an overnight emergency shift that I was doing. And I went in, and it was a mom and a daughter. Daughter was probably 14-ish, and the daughter had dropped her puppy. The puppy had hurt himself, and they had come to the ER. So I went in, I did my thing, talked to them. I was going to say we were going to go back and get some x-rays. And the daughter burst out, "Don't hurt my dog." I was taken aback. I was like, of course not. We're here to help. And so I went back and we did the stuff. And then as I rotated back onto days, and I was actually working with a feline internal medicine specialist. And I was just recounting my overnight experience. And he said, "Wait, what?" She said, "What to you?" And I told him, and he said, "Under no circumstances, as a veterinarian, do you need to take that kind of abuse. From now on, feel empowered," and et cetera. And he just rolled with it. And I was like, wow. So I don't know about you. In my internship, there was definitely some imposter syndrome. There was trying to figure it out as we were going along, doing the best that we could. But to have somebody support me and say, no, this is not appropriate. And you don't have to take that. Like that meant a lot. So luckily I got that talk, that encouragement, that empowerment at an early point in my career. And you're right, to some degree, internship, residency, you're at a point where you're a little bit beholden to what the institution says that you're going to do or you're not going to do. But I agree. I don't think that people should take abuse. I think that there's a place for being able to stand up and say, we're here doing our job. I didn't hurt your puppy. I'm going to go fix your puppy, but only if you talk to me appropriately.
Only if you talk to me nicely. Thank you.
Yeah. And
It's a fine line between, kind of handling it and just knowing it's not personal
yeah,
and, just being able to kind of carry on in situations where you don't really, it's the stoicism. Like you didn't have the choice. This is the client you have. This is the patient. They need your help. You're in a situation where you're just going to handle it. Right. And so like those circumstances are out of your control. You can control your behavior and nothing else. And then when you're in a situation where you do have the ability to control what kinds of patients you want, how you'd like to be spoken to, then to take action to make that happen. And I think it's really a balance between accepting, abuse versus having grace with a person who's just like not okay.
yeah,
And I think there's a balance there.
yeah.
And
And I think,
thing.
it is. And it takes a lot for me to even consider firing a client.
Yeah.
Although
I'm opposite.
all of my doctors know that they absolutely have the right and the authority to do so. They don't have to come to me. They don't have to go to a superior.
Bravo.
If, if they're being mistreated, they know they're being mistreated. For me, I always try first to remember that the owner is trying to find a solution for a problem for their pet. And this may be the worst thing that has ever happened to them.
Sometimes, yeah.
And so if I can work through that and find the light at the end of the tunnel, then everybody wins. But if it's just a mean person, that's not going to fly.
Exactly. Exactly. I love that you empower your people to set the boundaries that they need to set because ultimately it's a boundary. So bravo. Yay. Flipper. What do you call these? Like what kind of flipper? Like steel flippers or something?
I'll call those flippers.
Flippers. For anyone that is not watching on the YouTube, we're doing seal flipper clapping. So, Bill, I'm just super excited to have you on the show and to chat with you after almost a decade.
I know.
Just kind of connect and hear what's been on your mind and where things are now and how it all relates to mobile. So, in closing, I have two questions. One, is there anything else that you'd like people to know about you or anything that you're working on, anything you want the veterinary community to know in general about you before we close up shop?
Well, at VSH North County, we're making some great changes. When I talk to candidates who are thinking about coming out and working at our hospital, or if we're talking about potential new staff members, which are really hard to find,
Yeah.
uh, there are a lot of businesses that have a mission statement and some core values, and they put it up on their website, but it doesn't really mean a lot.
Mm-hmm. Mm-hmm.
At our hospital, we value culture, we value team, and I let the candidates know right from the beginning. We're doing a phone interview. I let them know this place is going to grow. We're going to become bigger and better. Bigger is not good enough. It's got to be bigger and better. And the way we become better is to maintain this culture. No matter how big we get, it's still the same culture. It's seamless interaction with specialists, ER doctors, staff, everybody from floor to ceiling. Everyone knows everyone. We work together. And the hospital will not bend the culture around the will of an individual. If an individual comes into our hospital, it's because they're bringing the right character, the right moral values, and the right kind of work ethic. So we're very selective. We're trying to bring the right people in to do the right thing and do it the right way. So I think that we can have sustainability in this field. We can do what we volunteered to do for decades, and we just try to have fun doing it. You had mentioned like 3 leadership tips that I might,
Yes, I'd love to hear your 3 leadership tips.
if I would be so bold as to give.
So, like, I have 3 pages written on this. How could you not ask that question?
Um,
Let's hear your tips.
I think tip 1 would be to assume that your team members are always doing the best job they can.
Love that. Love it.
Assume that they're working as hard as they can. They're doing the best that they can. And like you had said, I believe as well, if they're not doing something the way you wanted it done, it very well could be that you just weren't clear in what you want. So assume that they're doing the best, set a really high standard, and hold yourself accountable to it first.
Great. Great.
Where you hold anybody else accountable to a high standard, make sure that you're holding yourself accountable to it. And then probably the biggest thing that I would say is we need to demystify this myth of perfection.
Oh, thank you. Thank you. Demystify away.
And especially in surgery, when I have new doctors who are coming in the internship, specialty internship, first day of orientation, we will sit down and I'll ask for a raise of hands. Who in this room thinks you're going to go through the next year and be perfect? Nobody raises their hand, which is good. I have yet to have somebody raise their hand.
It's like you're fired. Thanks for
Yeah.
letting me know.
Oh, you're the guy. Okay. All right. The fact is, and I tell them, nobody's going to be perfect over the next year, the rest of your career. The best you can do is to make a perfect effort. So try really hard. Do your best. Don't expect to be perfect. If you're holding yourself to a standard of perfection, or if you're holding if your team thinks that they have to be perfect all the time, there's too much tension. There's too much resistance. They're not able to just be free to go and work at their highest level for fear of making a mistake. And so you get underperformers who are just trying not to make a mistake. Don't expect to be perfect. Just do the best that you can. And I think if we aim for perfect and we fall short and end up at excellent, then we're doing all right.
Absolutely. I think that's brilliant advice. I mean, what about like if you go to vet school and teach there? Because I think that these messages need to come so much sooner than internship. We all hatched from vet school with so much damage. And I think you're probably in a position where you're undoing a lot of that. Like some of us walked into vet school perfectionists and then we got worse. And it just got worse
Yeah.
from there. And If
Yeah.
someone could just reinforce that kind of thinking for all of us earlier, that our work has the potential to come from joy and inspiration and true self-actualization. Like, I want to do the best I can because I care about this, rather than fear of not being perfect, fear of not getting it right, fear of the board, fear of the clients doing, fear of your mentors, fear of the fucking residents, all
All
I'm
there.
making myself clear. Um, I mean, it's just like, God, I mean, I don't think anyone can really say to our cohort of professionals that message enough
Yeah, I agree. I mean,
early enough.
early enough, I will flat say when we had our orientation as vet students, so before I had started my first year, we were having lunch and they looked out and each person got up and had a little speech and it was nice. And they said, "You are the future of veterinary medicine." We're the future.
Damn.
And then we had somebody who got up and said, "Look, you guys have worked really hard to get the grades you needed to get into vet school. Now it's not about making grades. It's about trying to learn and become good doctors." And I was the guy sitting in the lunchroom looking around saying, "Yeah, all of you, don't worry about making your grades. And I'm going to stomp on you because I need to make my grades to get my residency. So you guys go ahead and pace yourselves. And I am going to go ahead and run as hard as I can." So having the message, man, it depends on who's listening, I think, and where they are in their mindset. But I think that definitely, man, in your surgery rotations, in your clinical years, fourth year clinics, residency training, internship training, all of that, I remember just trying not to screw up.
Yeah.
And if I could go back and do my residency again, I just think about how much I would learn, just pushing the boundaries a little bit more, not being so, but I was afraid of not being perfect, not being correct. And so, yeah, I have given some consideration, I guess, to the idea of teaching in the vet school. It'd be fun, but it would have to be the right kind of place. And I don't know where that place is currently, but
Maybe it might not exist yet, but maybe we'll fix that.
maybe, maybe. I certainly don't mind going to places and talking. Like I love going to the RBT schools and talking about the special things that are out there. Like
Yeah.
how many people have only known GP and they're going to go into GP and they're going to do the GP. And if they had known that there was something else, then they might have changed their whole trajectory. So yeah, I would try to steal as many great RETs as I could to just try to do some fun stuff. But I would love to go and I mean, you remember how it was being a student and being enthusiastic and being young and ready to set the whole world on fire and all that stuff.
Hmm.
Catching them when they're there would be awesome.
Yeah. Yeah. The formative years.
Yes.
But anyway, thank you so much. These are wonderful tips. Thank you for speaking with my group of house call vet babies and grown-ups and and all of us. Just super inspiring and wonderful. And so I wanted to close our episode with a final question.
Oh
Since
boy.
we are in the cafe of the house call vets.
Okay.
What is your favorite beverage?
And this is going to sound boring. Oh, you know what? I was recently introduced by one of our interns who got a residency position on match day. And so it was a celebration.
Cool.
And he pulled out a bottle of Screwball.
Screwball. Huh.
Have you
It
ever
wasn't
heard
a
of
bug ball, right?
Have you heard of Fireball?
Yes. Fireball's awesome.
So Screwball is peanut butter flavored whiskey.
Oh, I have had that. It is delicious.
It was so good. So like, I don't go to that on a daily basis, but if I were thinking, what is a unique beverage that I did not know how much I enjoyed until we celebrated match day?
Whiskey. Yes. Thank you for reminding me of that. I've had it before and it is damn good.
It's like frighteningly good,
Frighteningly good.
dangerous. And then obviously Mountain Dew Slurpee.
All right. Fantastic. Thank you.
Thank you for having me, Eve. I appreciate it. Been fun.
Awesome. We'll talk soon.
Sounds great. Take care.
Thank you so much for listening to this episode of the House Call Vet Cafe. If you enjoyed this episode, then hit the subscribe or follow button on Apple Podcasts, Spotify, Google Podcasts, YouTube, or wherever you listen to podcasts so you never have to miss an episode. This podcast is made specifically for you, so don't be shy if you'd like to reach out and let me know your thoughts on this episode. You can find me on Instagram and Facebook as the House Call Vet Academy, where I also share more valuable content. If you're interested in learning more about consulting for house call vets or the House Call Vet Academy online course and community, please click on the link in the show notes. Have an amazing rest of your day, and I can't wait for you to join us for our next episode of the House Call Vet Cafe.